Low back pain can be not only painful, it can be disabling. And one of the most concerning facts that people have is what's causing this low back pain in the first place. Because when you don't know what the cause of that low back pain is, it makes it way more difficult to handle the pain psychologically. So today we're going to discuss the different structures in your back that may be causing pain, how they will talk to you or what their pain pattern is, and what that means for you in the long term. Let's go, PT. First off, we're going to start with the most common. That would be either a muscle or a ligament strain. Now, when this happens, it's most likely due to one of two reasons. It may be a repetitive motion that you do all the time. So if you were out this weekend picking up all the leaves in the yard for like 8 hours and repetitively bending forward without using the best form, that could be causing a ligament or muscle strain. However, it can also be to a sudden motion. I had a patient once who was plugging in her vacuum cleaner cord into the socket, and that sudden motion caused her back to go out. Now, hers wasn't actually a muscle strain in this particular sense, but that can happen, that the muscle can get strained very, very suddenly and cause a sharp pain. Most commonly, a ligament or muscle strain will start as a sharp pain initially to get you out of that position, whatever it was. And then you'll stand up and it'll feel better. You'll kind of rub that area most commonly and be like, wow, that was really sharp and sore. Over time, that will become a dull, achy kind of pain. So it'll be something that it doesn't necessarily bother you with every motion, but with certain motions, and definitely if you're repeating motions over time, it'll get worse. Now, the good news is this responds really well to ice, and usually if you kind of lay low, avoid that motion for a day or two, this is going to be feeling much better, particularly if it's a muscle strain. See, the thing is, muscles have a really good blood supply, so they heal very quickly. Ligaments, they take a little bit longer. So if your ligament has been strained, it is going to take a little bit longer. You need to be more protective of your motions to make sure that this doesn't create a different problem moving forward. But I definitely recommend ice and watching your motions for a muscle or ligament strain. Now, what if you have a disc problem? There's different degrees of disc problems. So we're going to start talking about either a bulging or a herniated disc. That's most commonly what will happen to the disc initially. Now, the discs are shock absorbers in between the vertebrae of the spine. They help the vertebrae, which make up the spine, to be able to move without the bones slamming into each other, because obviously that would be painful. However, sometimes those discs can get a little bit too much pressure on them and they start to bulge out. And that actually means that they come out and kind of form a pocket on the outside. When this happens, this will usually be a very sharp, sudden pain, and it will be followed by a repetition of that pain whenever you do that motion. Now, it may be a triplanar motion or when you're moving in 3 positions at once. So think about if you're bending forward to pick up the soap that you dropped in the shower, that is a triplanar motion. Most people, if they have a disc problem, can find a motion that is pain-free as long as they stay in one plane. So it could be front back, it could be side side. Most commonly though, it's actually rotation. And the cool thing is that rotation can actually help to heal the disc. So if you feel like your problem is a disc problem, try some rotation exercises, straight rotation exercises. You can't do triplanar motions when that disc is really bulged and aggravated. Now, here's the thing, a bulged disc, if it gets too much pinch or too much compression, can actually herniate. Now, this is when the discal material from inside the disc goes outside the disc. This is a really big problem because the nerve roots are right there. This is the most common cause of nerve root problems, including sciatica. So if your discal material has escaped the disc, it will irritate the nerve and cause numbness and tingling and things to go into your legs. At this point, the disc is still capable of healing, but it's going to take longer. So you need to proceed with caution. Be very careful with your motions for a couple of days. Yes, I want you to move as much as you can pain-free, but do be really careful, a little bit guarded with those motions for a couple of days while that discal material is reabsorbing. Now, what if you've been told that you have arthritis in your spine, or you may be wondering if you have arthritis in your spine? So arthritis can form in any joint. And obviously your spine is full of joints. People who have arthritis in their spine often complain of pain more after rest, so think sleeping or prolonged sitting, than they do with activity. Often they can do all their activities, they can run, they can walk, they can jump, they can skip, and it does not actually cause increased pain. However, sleeping or sitting for a prolonged period of time does increase the pain. Now, arthritis is normal as we age. Unfortunately, gravity pushes down on our head. Our posture is not always the best. It does happen over time. It doesn't necessarily mean that this is what's causing your pain. I can guarantee you, if you have an X-ray or an MRI or some imaging and you're over the age of 20 years old, you're probably going to find some arthritis in your spine. However, that doesn't necessarily mean it's the cause of your pain. If you do have achiness when you wake up in the morning and pain after prolonged sitting or being stationary for a long period of time, then I would most likely say that you do have arthritis. The goal here would be to keep as active as you can during the day, within reason, and make sure that you have a really supportive bed at night and that you are well supported in your sleeping position. Now, a less common cause of low back pain, but one that does need to be discussed, is osteoporosis. If you have been diagnosed with osteoporosis or osteopenia, that does mean you are more likely to suffer from a fracture in the vertebrae. Now, those are really not good, because now you are going to have to be more stationary, more sedentary while your body heals that fracture. So we do want to be really, really careful with this. And if you have already been diagnosed with osteopenia or osteoporosis, and you start to have a sudden onset of sharp pain or even a sudden onset of dull, achy pain, you definitely need to seek help from a specialist, because we want to make sure that that vertebrae is not fractured. We don't want to be trying to do any exercises on top of that until we're really clear on what's going on with your spine. Another diagnosis that I feel is becoming more and more common in these days is ankylosing spondylitis. Now, this is an inflammatory disorder that affects the spine. It usually affects the SI joints first, that's in your hips, underneath your glutes, and then it will move its way up your spine, usually starting in the lumbar spine or the low back. Now, this kind of has some combinations of everything, because what happens is that the vertebrae actually fuse together over time, which means you're going to have the achiness initially of arthritis because you have this local inflammation going on. It also means that your muscles and your ligaments are not going to move correctly. So you may have muscle sprain, strain, ligament injury type of things going on, as well as having just this general inflammation. Malaise is probably the best word. It feels like you are stiff and you can't stretch enough. That would be the biggest thing I would say with ankylosing spondylitis. If you feel like you have actually really been diligent about trying to stretch and you continue to feel stiffness day after day after day, then you may want to go get checked with a specialist to see if you have ankylosing spondylitis. Now, it's important to make sure before you get the diagnosis that you have an X-ray to see what's going on with your spine, and also have some blood work to see if they see the inflammatory markers. Ankylosing spondylitis is its own thing and it's treated in its own way. It's kind of like osteoporosis. You can't just treat it like everything else. So it's important to make sure you know exactly what's going on with you. So there's the most common to least common causes of low back pain. If you have more questions about your low back pain or what you can do about it, I'm going to recommend you check out this video here. If you'd like to learn more about low back pain and how that relates to what else is going on with your body, check out my book, Movement is Life. We'll drop a link below.